Well, do you remember there was a dentist that, because we went to Indiana, right? There was a dentist, and I remember he told us he would charge people based on how much of a pain in the ass they were. All right, cool, Alex. So on today's show, we figured we'd bring an old friend on, right? He was our vice president of our class. Mm-hmm. I was roommates with him for a year.
And a fellow Canadian.
And your fellow Canadian.
Yes.
Yeah, is Dante. So Dante's up in Sault Ste. Marie, which probably 1% of you know where that actually is. It's actually a funny town because it's a border town. So there's a American and a Canadian Sault Ste. Marie, right, Dante?
That's right.
Yeah.
No, we're in the Upper Peninsula, between Upper Peninsula, Michigan, and Northern Ontario. And I'll say thanks to both of you for having me here. This is a nice treat to see both Eric and Alex, and thanks for having me on the podcast. I'm excited to talk about dental topics, American dental topics, Canadian dental topics, and just shoot the breeze with you guys and catch up.
Sounds like a good plan. Yeah.
And I mean, we probably owe a thanks to you and a lot of our leadership in our dental school class. So like, I feel like our dental school class actually, we got along really well.
Yeah.
There was a good group of
agree.
us that, you'd have these, I don't know how other people's dental schools were, but we had like pretty much first, second year was like 2-week sprints, right? You'd have all these classes and then they would give you a test on like a Thursday or Friday. And then you would party on the weekend and then start again. And I feel like we always had a good group of people that just kind of hung out, shared stuff together. There wasn't a lot of competition. And I feel like a lot of that was due to our leadership, right? Like our president, Eric, was really good about that. Dante was really good too. Like our social chair, everyone that was in a leadership position was pretty outgoing and kind of like, it kind of starts at the top, and they were like that. So then a lot of us were like that. Cause I mean, Dante started a tradition that I guess still goes on to this day, he told us. And it is called the Cuspid Crawl. So we started that. It was first year, right? Or was it?
Well, we started as second years to welcome the first year students, because we said, you know what, it'd be nice to have some sort of fun social events. You start dental school, like you said, like you kind of are a big family, right? Like your whole schedule, like for every week, every 2 weeks, an exam, have some downtime, let's get together, let's have some fun. But to know the lay of the land, to know the school, the other classmates, you're not just your own classmates, but upper year students as well. I said, well, we didn't really have something like that in our first year. So I said, well, it'd be nice to do, I think we did a family barbecue as well. We always did that as well, not just the bar crawl. But so we went to the Dean of Student Affairs. Me and Ravi actually went to the Dean of Student Affairs and said, we'd like to do a bar crawl. Like it'd be a fun
yeah, I know, right?
We'll
like
try and represent.
I
don't know why they said yes, but they did. And so we said, this is awesome. Hey, let's do this. So we got like t-shirt designs. Everyone wore the same t-shirt. So we'd have like those of us in second year, and then these first year dental students, right? That was the first time. And so we got t-shirts made, and we got sponsors. So why don't we get, who's going to pay for all this
we
stuff?
somehow you convinced people to pay us to pretty much like
genius.
Go to bars.
This is genius.
Yes,
So,
like dental supply companies. I think the place that made our t-shirts. They said, put your logo on the back and take some money off it, pretty much, and they did too, right? So I don't know how we did this, but we did. And I remember the first couple ones too. We did a graffiti themed crawl too, and we're like, let's see. I feel like this stuff wouldn't happen anymore.
Oh yeah, I remember. I still have my T-shirt is up in my closet, and it has signatures. Like we all like wrote on each other's shirt throughout the night, fun. And that was really fun.
Because it was a good icebreaker. It's like, hi, I don't know anybody here. You have a T-shirt. It's I think white or like light color and that. So and everyone got a marker. And there was the beer drinking tooth in the middle here.
Who designed that? Was that you?
I want to say it was the people who the printing place that made the
Patterson
t-shirts. I just said make
like,
it look like a t-shirt, like with a beer drinking tooth, and they did. And so everyone got a marker. So hi, nice to meet you. What's your name? Your name's Eric. Okay, Eric, I'll sign your shirt. So that's the idea in theory. And then as the night, what I didn't realize is as the night would go on, and maybe the more drinks people would have, and that the stuff people would sign would be a lot more and a lot different than just with their names.
Yeah, a lot more inappropriate.
So I think everyone probably woke up the next morning and said, what's with all this stuff on my shirt, or what are all these pictures and all these names, phone numbers, whatever else people would have on there, right? But that often changed. We just went from that to like a colored shirt, whatever the case.
But do you remember? So I think it was the first year we did it. Did the school tell you like, hey, we're good, just don't mention, like, don't be out at a bar and like mention Indiana University School of Dentistry?
Right.
And it was
be careful who you are. So that's
what
I said. It said Cuspid Crawl. It didn't say IU School of Dentistry. Just obviously we contacted like 3 or 4 bars ahead of time, said we're going to be here with 200 people.
So, this was like scheduled.
Yeah, but which
like,
was the bar?
Because
you remember the story behind it. That was the one thing they were like, just don't mention it. And we were at the bar downtown, and I think, wasn't it George got in front of everyone, and didn't he like just shout out? He was like, Indiana University School of Dentistry, like, class of 2013.
The DJ booth. Someone got in the DJ booth or something, right? It was
The other fun story that a lot of us remember from Dante, to paint a picture of him, is, I don't know when other dental school classes did, but first year in the summer, right when we were kind of getting to know each other, we did anatomy lab. That was the first thing, right, where you pretty much dissect the cadaver. Mm-hmm. And I remember I was diagonal of your table, and each table had maybe like 5 to 6 students there, and we're dissecting. And then all of a sudden someone yells out like, there's fire. And we look, and Dante's hair is smoking. And so you had those really strong lights, overhead lights, and it got too close to the top of his head, and his hair started smoking.
Not even realizing it.
Yeah.
And I was thinking, all right,
where's this random ass nerve that I need to find?
Like I'm going bald. I don't have as much anymore, but my hair is red, right? So I'm like, just another someone making fun of the redhead here. Their hair is on fire, ha ha ha. But no, really, the overhead light was probably an inch from my head. It's all dialed in, focused on what's going on and what we're dissecting, this and that. And I'm like, it was smoking, and it was probably almost on fire. And everyone's just looking at me, and probably within the first couple weeks of school, saying, this guy's just probably a crazy Canadian in our class here.
Yep.
Yeah.
No, that's funny.
So yeah, Dante, so once you graduated, you went straight back to your hometown, right? Like Sault Ste. Marie's where you grew up, you went to school and all that.
Yeah, so that's my hometown. That's right. I've been back since graduation. Quick synopsis, I associated at a practice for 2 years first. They're owned by a DSO here in Canada, this is a long time ago when DSOs were just kind of becoming a thing back then, right? Great opportunity for me as an associate to grow and learn from. The dentists there were wonderful mentors to me, I couldn't ask for anything better. But long term, I wanted to be in a position to own a practice.
Yeah.
So went to a new practice. It was a new build, and at the year became an associate with Peter, who again is a wonderful mentor to me. I associated with him for about 6 or 7 years. It kind of ended up being until I bought the practice. He stayed on for a year. We had another associate for 3 years after that. But I enjoyed it. It's what I want to do. It's try and look at look ahead and be like, what do I want to be doing in a year, 2 years, 5 years, 10 years? You want to be able to do new things. Just keep motivated. A lot of challenges since being the owner. I know you guys probably all face similar challenges. But it's good. It's what makes us. What gives us things to talk about as dentists.
Nice. Well, I was thinking what would be fun is because I was talking to, I think Alex and I were joking about the whole like American Canadian thing and all that kind of stuff, and I was like, you know what? I wonder how many differences actually kind of exist between like dentistry in America and dentistry up north.
Yeah.
And then I was like, oh yeah, we just got to get Dante on because I feel like a lot of people don't really know some of those like little differences, and we just kind of assume that Canada just does everything that America does, right? I think that's maybe an American ego thing, but
Yeah,
but
maybe.
we
And
tend
and
to
if
think
you're
that.
and if you're Canadian like me, I'm thinking everybody just does everything like I'm used to, right? So it's good for
Yeah.
us to figure
Yeah,
this out.
yeah.
So
Do you want to start with some like codes? Like
one
differences
thing
and
that I
stuff?
thought was cool. So explain to us, Dante, because I think this one's probably this is like the biggest difference I noticed is how do you guys like, I guess, code out perio? So for reference, like I'm talking about when a patient needs an SRP, we say, is it limited or full, right? Is it 1 to 3 teeth per quad, or is it 4 or more teeth per quad? And that's what our code is, and that's what we bill out to insurance. So how do you guys do it?
It's the scaling is, whether scaling or there are root planing codes, there are scaling codes, but typically we would use the scaling codes. A lot of, especially in insurance, is a lot of, X amount of scaling units per year. A scaling unit is defined by 15 minutes of treatment. So instrument to the tooth. That's scaling. It's not polishing. Polishing is its own code.
Oh, really?
So let's say you're, have a patient in the chair, say they're booked for an hour with the hygienist. Okay. They might be, 2 to 3 units of scaling. So that's somewhere between 30 to 45 minutes. There's even half unit codes. So if they're closer to 37.5 minutes, that's 2.5 units of scale.
Wow.
Oh,
Okay.
wow.
Polish is another one. So a half unit of time is 7.5 minutes. So generally for polishing, they're not going to do more than half a unit, right? So half unit of polish. Recall exam, another code. I'm going to go in and check their teeth.
Mhm.
Say they had x-rays in there. So it means everything is itemized like that. So let's say we would have used 3 units of their scaling, and their insurance covers 12 units a year, and they need to be seen every 6 months. Great. We only use 6 units of scaling for them. Say they have some perio needs, and they're perio patient. Like I said, they have whatever staging and grading of a perio that they would have. So we need to see you every 3 months. Well, we might do 3 units of scale every 3 months, and that's going to be 12 units a year. So it's time based. Everything in Canada with perio is time based. A lot of the hygiene.
That's so interesting. I feel like then it's a lot more. I feel like there's more trust in that. I mean, do people then? Is that
Milk
like a
the
thing
clock?
that?
Like-
Yeah. Do people is I mean,
Is that a
The
thing?
hygienists the hygienists are pretty well obligated to have look at the clock, and they document that in their notes. A lot of times they'll sometimes some hygienists I've seen in some of their notes will be very specific, like 32 minutes of scaling or something like that, or they'll just put.
Wow.
A lot of our notes are what do you call it? They have
Like
checklists and things
timestamps?
like that. So like it'll say, like, they'll just put in their note between 30 and 37.5 minutes of scaling usually. So if a patient were to come back and say, well, why is my bill this? Why is that? Well, that's why they scaled your teeth for 2 units. They did this, they did that. I think there's more documentation that kind of can come back on and say that. There's your evidence. This is your perio diagnosis. This is your stage or grade, and this is why we needed, this many units. This is why you come in every 4.5 months.
So insurance will
Wow.
cover. Let's just kind of think about this. So you said they normally will cover 12 hours, and that includes
12 units.
Units. No.
sorry.
Units
12
are 15-minute times.
12.
So maybe some are
So it's
12, some are 16, some are unlimited. Some
Okay.
governments plans, like there's some provinces may have limited government plans that, and even federally we have a new plan in Canada that covers 4 units a year. So it's not much. That's 1 hour of scaling, but it could be broken up to 2 units now, 2 units in 6 months. Maybe they need to use all 4 of them now, and then they have to pay for their next visit, right? So
when you say scaling, just so we know, is scaling SRP, perio maintenance, and prophy?
No.
yes, it's a generalized
Really?
term. Yes, different than what we learned
Holy-
in school
holy
in,
moly.
in the States.
Hey, quick break here. If you're enjoying Just a Couple Dentists, don't forget to follow or subscribe wherever you're listening. It's the best way to keep up with new episodes and hear us argue about dumb stuff and complain about dentistry. And trust me, you don't want to miss that. Now back to the show. Do a lot of practices in your town, do most take insurance? Do you feel like in Canada most you don't get a lot of fee for service?
So totally different, I'd say, in Canada, the US here for insurances. Like, you guys take certain insurances, and my understanding is you take the insurance, they set the fee guide, correct?
Mm-hmm.
Yeah.
So totally different in Canada. I use the Ontario Dental Association fee guide, or suggested fee guide. So it doesn't matter if you paid you can come and get the same 1/6 mo filling, and that fee guide says it's going to be, I don't know, $300. I'm just making it, it's around that. And Eric, you're coming for that filling, and you pay cash, and I'm charging the fee guide. You're paying $300. Alex comes in because she has benefits from her job, and she's a 1/6 mo filling. She's my next patient, and it's still $300. Now, whether her insurance covers 100% of it, 80% of it, they covered last year's fee guide on it, it doesn't matter. We're going to charge $300, and the patient can pay the difference.
Yeah, and insurance
we
pick
can,
up the rest.
you are allowed to balance
like
bill. That's huge. Okay.
Yeah.
That's huge. You can do that.
Okay, explain. Yeah, go ahead. So what were you saying, Alex? Because you can be the bridge between.
No.
She's a half Canadian.
Yeah. So she.
Let me translate.
Yeah. Can you translate
that?
No,
it seems like it would be like in our case, you set a fee, and then if insurance picks up part of it, then they pick that up, but according to your fee schedule, like the set fee schedule.
Okay. Your insurance. Your insurance is a subsidy for what the fees we charge. That's not me being like the only person in the world doing this. That's how practices work in Canada.
So do you have to accept that fee schedule though, or could you?
No. So I don't. One word I use is it's a suggested fee guide.
Yeah, I heard that.
Okay, you caught that. So suggested means insurances will use the ODA suggested fee guide. Okay, but if I want to say, okay, Alex, I said that filling would be $300, but the next person that comes in, I want to charge them $400. Okay, and they have insurance. Insurance picks up $300 of it. So how come I owe $100? Well, because it's just a suggested fee. Those are our fees. You could do that. Now I live in practice in a small enough city where you start doing things like that. You get a bad name real fast, and you become you don't want to be the greedy dentist, right?
Well, do you remember there was a dentist that, because we went to Indiana, right? There was a dentist, and I remember he told us he would charge people based on how much of a pain in the ass they were. And so he would do it that way. We've never done that.
How close do they look in the mirror? If the mirror's right here for that crown, or if they look at it out here, it's that thing. It's right, like the same idea.
Okay, the other thing that I thought was cool that we could pivot to is, do you guys have, so in the States, a lot of states now have like EDAs or FDAs, and that just stands for like an expanded duties assistant. So like they can do final impressions, they can place fillings, they can
like pat cord.
They can do a lot of like extra things that kind of can free up the doctor's time, and they're trained well and they do a really good job. Mm-hmm. Do you guys have anything like that in Canada or in Ontario?
Good question. We don't have expanded function assistants here in Canada, but the equivalent role would be by a restorative hygienist in Canada.
Yeah.
So
tell us about
a restorative hygienist. Yeah. So is like a licensed RDH, but has to go back to school for a specialty. It's a specialty program. Few colleges, universities offer it, not many, if I remember correctly. And so it's an extra year or X amount of weeks, like both it could be online and in person learning, totally in person. Depends on the program. But anyways, it's for a restorative hygienist, they would be able to do all those duties that you guys just mentioned. In one breath, it makes more sense that the assistant does a lot of that because that's their day-to-day job. But I've actually have experience with a restorative hygienist, as just within the last year. I have a hygienist who went back to school last year, became a restorative hygienist. It's a big change to the practice and the workflow. So how we work is when she works with me right now a couple days a week, like half days, and we're gonna go into having her morph into 3 full days a week come the spring. I work in 2 rooms with 2 assistants. Okay, so I'll see patient 1, I'll prep their teeth, she'll restore their teeth. While she's doing that, I'm working on patient 2 with assistant 2, and either I'll kind of work the one column, she'll work the other, or she'll just follow me one or the other. I can also do like major, let's say doing an endo, so do the endo or a crown prep, I'll give myself extra time because that extra half hour or so I'll give myself, will be for the freeze and prep, her patient or patients that she would see in there. So what she can do is she can make provisional crowns, cement provisional crowns, take final impressions, whether it's with PVS, whether it's with a scanner, pack cord, restorations, everything.
And they can give anesthetic too, right?
No, that's province to province, not in Ontario. And I think Alberta.
Now, is that under the hygienist or under the? I guess all hygienists.
No, because they're all restorative hygienists. I'm understanding are RDHs. Right?
Yeah. So okay.
Yes.
So interesting.
The ability to give anesthetic is up to the hygiene licensing body in each province.
Oh. Okay.
So guess who goes in? I have to go in and give local there.
Oh, wow.
So when you have a restorative hygienist working with you, they're not cleaning patients as well, or are they also seeing hygiene patients, or are they just like your
not at the
buddy
same time? No, she won't have her own call of hygiene patients. She just
okay, so it's pretty much like she becomes an EDA. I think from a money standpoint, in America it might be a little bit better because I would imagine our EDAs make cheaper. Less than your hygienists, right?
I would imagine you're correct.
Yeah. So you're paying more per hour for someone to restore and do all that stuff. So So I'd say on our end it's probably cheaper for us, like from a business perspective.
Well, yeah,
100%.
But then the argument could be, well, now you've got a restorative hygienist who already is an RDH. They're already really trained in dentistry. They have a big background, and then they're doing another year of restorative stuff. So they're like,
I'll speak on that for a sec here. At first, I'm like, because I remember going to school at IU. I'm like, remember like the expanded function. There was even a program at our dental school, and I'm like, this makes way more sense. These assistants, they're the ones learning the restorative instruments, this and that, and everything. But as a hygienist, when she's sculpting fillings and polishing, and she's going to take, I'm going to be honest here, she takes better attention to margins and overhang and contacts and that than even I do. And the reason for that is that she, particular restorative hygienist I work with, she's been a hygienist for more than 15 years. I don't know, 15, 16, 17 years, I want to say. I'm trying to figure out. Anyways, but all those years of her scaling teeth and that, think about it, they're the ones who they're nitpicking margins, and they deal with this stuff all the time. They don't want that. They don't want to do a filling or two.
Yeah,
that person ends up back in their chair for the next hygiene appointment. Yeah. And so, she's been excellent that way. And there's something, awesome. And I think you're only getting that from hygienists.
Yeah,
right.
Probably.
They look at things in a different lens than we do.
Well, it's kind of like when, if you're going to refer out, say, an implant to get done, and it was on an anterior tooth, you might say like, well, the periodontist is really going to focus in on like the gum tissue, right, and how like the contours of that are.
Sure.
And I'm sure there's oral surgeons that do as well, but you might say like, a periodontist might have more knowledge in that part, so I'll probably refer that over to the periodontist, right? So it seems like you're saying like same concept. Yeah.
Yes.
So what about pay structure with your hygienists? Are they mostly hourly, or is there
They're
any
all
type
hourly.
of like hourly?
Is it the same as it is in the States now, where you guys have a shortage, and are they asking for a lot more than they used to be?
Yes. I would say their wages are, from when I bought the practice 3 years ago, like 30% more.
Yeah. And is that in that? Yeah. I mean, I guess you're in Canadian dollar versus American, but I wonder if
30% more than they were, which is like probably like 70% less than what yours makes with the American dollar. It's
right.
But no, it's not just a Sault Ste. Marie thing. It's not an Ontario thing. It's a national thing. It sounds like it's definitely an American thing. I remember hearing about that too.
Real quick, if you're into what we're talking about and want more, check out my newsletter, Just 2 Minutes. It's the dental blog you can actually read between patients. No fluff, no BS, just straight up tips, stories, and insights to help you level up. You can subscribe over at coupleofdentists.com or just hit the link in our show notes. Now back to the pod.
You guys even like going back like outside of that, I always thought it was interesting. Your guys' boards exams are different than ours too, right? Like,
yes.
So in America, and I think they're changing some of it, but at least when we graduated, you had live patients, you had to do like perio on patients, you had to do fillings on patients. Mm-hmm. Endo, we had to do it on a on a model, but
Yes.
you guys just have like, it's a station exam, right? You go from like
Yes.
station to station and you answer questions. There's not a live patient part, is there?
No, so it was 2 days, and I don't know if they changed it. This is, we've been out of school 12 years almost now, right? So I think it's still the same, but in Canada they have the National Dental Examining Board exams. So it was a 2-day exam. The first day was a multiple choice, like a
Written. Yep.
didactic part of it, right? And it was 200 questions, 300 questions, I can't remember, but it was more similar to National Board's Part 2 for us. So
Okay, so
in the
just
States.
for reference, yeah, like you're taking just a big written exam.
Yeah.
Yeah.
I think ours has like a little bit more like microbio and biochem. There was some like really random stuff on it.
On our Part 2 or Part 1 or both?
Part
or
1,
regional.
I think.
Yeah, so we had to take, let's go
take
back
that
even
part
another
first.
step here.
Yep.
In the States, we had to do a Part 1, which was all, microbio or chem or bio, all the stuff we
that
learned,
use every day.
systems of the body, all the stuff we learned in the first years of dental school.
Yeah.
Part 2, which we took in our last year, which was basically restorative dentistry, oral surgery, endo, perio, all that more dental related than that. That's pretty much the first day of the National Boards of Canada. Was that exam.
Okay.
The second day was like a station exam. Yeah, you went around in a room.
Name this perio probe. Yeah.
Name this thing. You can't, or these radiographs. Where is interproximal caries? Which teeth? First of all, here's me figuring out, all right, I came here from the States 2 days ago. What I think is tooth number,
Oh yeah.
Tooth number should be
tooth number
I
9
do remember
is now
that. We had to
1,
convert.
I'm thinking,
Yeah.
right, trying to figure out which number these are here.
Oh yeah, because how do you guys know them there? Because
so it's by quad. Well, you can explain it, but yeah, it's by quad.
So upper
what's
right
tooth number?
central is
what's
1
tooth
1.
number 8?
1
Up. So 8 would be 1 1. That's right. And 9 would be 2 1.
Yeah. So
And
it
then
starts at 1
10,
and goes all the way back.
And you keep on going back. So the laterals, you're 7 and 10, like 7 and 10 would be 1 2 and 2 2.
So is this similar to like the rest of everything in America?
It's,
Is that
so that's
we do
another
things our
similar
own way
difference
and
we have
everyone
here.
else
Yes.
is internet.
Yeah.
America is different than the rest of the world. Just like you driving miles and all, we'll go on and on here about all these things here. It's one of those too. But so that was the second day. So all these things. Look at the radiographs. If you have to write a prescription for this patient based on their age and weight, what would you write? So when the bell rings, you have 5 minutes. You go to the next station. Turn all that stuff in.
See, so that actually, at least you don't have to rely on other people. I don't remember. I think you took the NERB, right, Dante? But we took the REB because we were going to go out to. I was going to be stationed in California, and if I wanted to practice out there, and Alex was going to be out there too, so we took the REB, and we had to take that in Louisville. I remember that when you guys went there. We had to find patients, which was already a pain in the butt.
Yeah.
And then we had to drive them down and put them up in a hotel room in Louisville.
And pay them.
I remember my dad telling me, so I was like, Dad, I need you to help me out. You need to pick up these 2 people in like downtown Indianapolis, and I need you to drive them down to Louisville. So I had to hope that they like showed up. Anyways, I remember my dad telling me the first guy gets into the car, and my dad looks behind him, and he's like, I see something shiny there. That's a freaking knife. Like, this guy's got a knife. And my dad's like, just out of curiosity, is that a knife that you have? And he's like, yeah, I'm not going to do anything. I just wasn't sure who you were, and I didn't know like if you were going to be sketchy, so like I just brought protection just in case. And I was like, oh my god. And like that same dude.
Did you tell your patient it was your father?
Yeah. Oh, yeah. So then he then the next morning it's 7 a.m. and you got to get to the dental school, right? And so we're all at the same hotel. We're obviously not sharing the same rooms. and so we knock on his door, no answer. Knock on his door, no answer. Like, the guy partied so hard the night before, he was just so hungover. Like, I remember having to get management and being like, I know I'm technically not supposed to be able to like open this guy's door, but I need him to be here for an exam. What can you do?
Yeah.
And like finally we slammed on the door and we knocked on it so hard that he woke up, and the dude was just, it was nice. He was so hungover that he probably didn't feel like when I had to numb him up, he was probably like, yeah, this is fine. So like,
oh my god. I don't think I ever knew that.
But those man, those were fun times.
Yeah.
I think they're starting to change it, and I think it had to change a little bit with COVID as well.
Yeah.
That kind of changed some of the things they had to do, at least some of the associates that I'll work with.
And to be fair, I mean, it's you're relying on a lot of things to go right that have nothing to do with dentistry. Like, are these people going to show up?
Yeah.
Are there, are there? You're relying on other people's time. You're bribing them to show up. Like, it is kind of ridiculous. The dental schools in Canada and the U.S. have an accreditation process, and if the school is good enough to be accredited by the body that does that, that should be good enough that, okay, if you graduate and pass our curriculum and you pass a national exam,
yeah,
you're probably fine.
Yeah.
And that's
but I
how it
think
is
we learned, I mean, you remember like some of our classmates, they were taking the NERB. I remember that. And one person that we're friends with, I think she failed it because her patient was done, but they were like, they didn't pass through like the cutoff at 5 p.m. Like, they were in line, but they weren't seen at 5. And because the line was long, they were like, we're leaving. We got to go to all the examiners were like, all right, well, we got to go to like St. Elmo's to go eat some steak. So we're going to get in our limos and head on out. And it like screwed over people. And it always felt so like kind of icky that like there's
not fair.
Exactly.
Yeah.
It's like almost they had to hit numbers and like fail a certain amount of people. So
it's
it
not a
seem like
true test of someone's ability when you're dealing with things like that. Like, it's...
Yeah. So yeah, that was always a pain to deal with. Okay, so I figured we could get on to something fun besides dentistry, right? And the differences between you guys and me and how we say words. Because recently there was a backstory on this. Alex and I were talking about, I don't know if you were going to buy our daughter like a shirt or something like that, and it came in a certain color. And I was like, oh, yeah, this color. And she's like, what the hell are you talking about? It's this. And I was like, what the hell are you talking about? I've never heard that before. And so we'll do this on the video version. We'll put the word below it. But I will spell the word. I will spell the word out. And then I want you guys to say how you guys pronounce it. And then I'll say the right way.
No, I was going to say
the right way.
Okay. No way.
Right. All right. So the first one, it's a color. How do you say Mauve?
My turn?
Yeah, you go first.
Mauve.
You? Mauve. You guys say mauve. It's mauve.
Yeah.
We always say it's mauve. And I remember that was
like,
the first one. And she's like, yeah, we need to get this in mauve. And I was like, yeah, what is mauve?
Mauve,
No, it's definitely mauve.
No, it's not. We even looked it up. I was like, this is how you, because it bothered me. I was like, no, I'm not wrong. And so, we had to look it up.
Yeah.
Alex and I are on the same page there.
Yeah, you guys will win on all these because you guys grew up there. Dante said this one earlier, like 5 minutes ago, and I was like, that made me laugh. So when you're talking about doing something, you say, what's the, and it's like process. I would say process, like everyone else would.
What did I say? Process?
Yes. Hard O's. Process. Yeah.
I feel like I switch.
Did you assimilate a little bit?
Oh, what's the process?
Like sometimes it's a process, and sometimes there's a process. Like it's like it just depends. The word is different.
Same. I'm with Alex. I'm like, I'm not hard on saying process.
It depends on the context of the sentence. That's what I think. But.
Yeah.
Last one. So if I don't know, we call them here, I guess, if they're like, if you were in like a trailer park, we would call them like this type of home. So mobile. I would say a mobile home.
Mobile.
Alex.
Mobile. Yeah.
Mobile. Yeah. You guys go hard on the I. Mobile home. Yeah.
A mobile phone.
Mobile phone? Yeah, that's...
Yeah.
Mobile phone.
Let me get my mobile out.
Yeah, that's funny. I appreciate you coming on and telling us all these new things about the Great North, Canada.
Yeah.
This is a lot of fun. Thank you.